The core mission of New Britain EMS is to provide unsurpassed pre-hospital medical care, and we do this through achieving clinical excellence, customer service, and community recognition. My name is Patrick Ciardulo. I'm the CEO and Chief of Service for New Britain Emergency Medical Services. We constantly strive to be on the forefront of clinical medicine and doing what's right by evidence-based practices.
My name is Matthew May. I'm the Captain of Professional Standards for New Britain Emergency Medical Services. There's an increasing amount of research that is on the forefront that's really pushing the evidence-based benefits of pre-hospital blood programs. So nationwide, pre-hospital blood programs are not common. Less than 2% of EMS ground agencies have the capability of delivering pre-hospital blood.
So when we're talking about blood administration in the field, the earlier the better. Not only in the field, so their risk of dying before we can even get them to a surgeon, but it also decreases their risk of death even after they make it to the hospital. So it's imperative. It's going to save so many lives having it pre-hospital.
This is just one step in saving lives for patients who are bleeding extensively from a traumatic injury. Up to a third of the patients who otherwise would have died can be saved with pre-hospital blood administration.
The challenge for most EMS agencies with developing a blood program is really the partnership with a blood bank, somebody who could supply the blood, keep it cold stored, and some necessary factors that go into maintaining a sustainable blood program.
To make this program possible, it took the partnership of three agencies: New Britain EMS, the Hospital of Central Connecticut, and the American Savings Foundation.
My name is Jess Gilday. I'm the Trauma Program Manager at the Hospital of Central Connecticut. This partnership is really important. It helps our trauma system work together as opposed to in silos, and it brings a unified approach to taking care of the patients in our community. This is incredibly impactful because having somebody treated appropriately in the field can make all the difference. The minutes go by and people can lose a lot of blood and increase their risk of mortality or dying if they don't have these blood products available to them in a very timely manner.
David Bono, Chief of the Emergency Department, Hospital Central Connecticut. It really does take a partnership to treat a patient, right? We don't do it all here in the hospital. It starts in the street. The more stabilized a patient is, the better chance for survival and the better outcomes, right? So the more that we can do out in the field, the better chances. So if somebody loses 4 liters of blood, almost all of their blood, we're behind the 8 ball. But in the field, if we can replace that blood, they come here with only a liter loss, maybe because we've replaced some of it already. And one of the things that they're doing now is the pre-hospital blood to improve survival and improve patient outcomes. And that's always what we're trying to do, right? Improve outcomes.
I'm Maria Falvo, President and CEO of the American Savings Foundation. The human services area that we fund is really looking at quality of life and health and wellness across the entire New Britain community. I think our board selects capital grants when they see that this is something, it's an investment in the infrastructure. A year or two, it's going to really make a difference for a long time.
So I think when you look at what a shared goal might be, it really is the commitment of each one of these individual organizations towards the same goal, and that's caring for our community, caring for the city of New Britain. And it shows that Hospital Central Connecticut, American Savings Foundation, and New Britain EMS are focused on this goal.